Chapter 14, Medication Limits feature. Setting medication limits. The Med Limits feature allows maximum amounts and minimum intervals to be programmed as an added safety measure. This feature may or may not be used in your institution. If there are no orders or mandates requiring soft limits, press the Yes Enter key to off, thereby accepting the factory default settings. However, if there is a physician's order or mandate requiring specific med limits, press the No Change key to change the off to on. Press the Yes Enter key to confirm the on setting, and enter the med limits setup menu. Enter the ordered soft limits for each field. Note that the med limits can be set higher than the prescribed amount, but not higher than the default settings. For maximum rate, use the numeric keys to enter the upper limits of the maximum med rate. The minimum rate is 0, and the maximum amount is equivalent to 9.9 milliliter basal rate in the IV administration route, 25 milliliter in the epidural route, and 5 milliliter in the sub-Q route. When the correct maximum med rate is entered, press the Yes Enter key to accept and advance to the next field. The delta rate and delta time is also known as the change rate or change time. For example, the clinician can increase the dose by no more than 2 milligrams every 10 minutes. Some prescriptions include incremental levels or delta limitations. If the prescription has these components, use the delta rate and delta time field to enter those limits. Once entered, press Yes Enter to move to the next field. Maximum bolus dose. Use this field to set the upper limit of the patient bolus or patient demand dose. If there is no bolus dose, enter 0. However, if a bolus dose or demand dose is ordered, enter the numeric value. The minimum value for this field is 0, and the maximum value for this field is a bolus equivalent of 9.9 milliliter in the IV route, 25 milliliter in the epidural route, and 5 milliliter in the sub-Q route. Enter the value and press Yes Enter to accept and move to the next field. Minimum bolus interval. Use this field to set the minimum amount of time allowed between patient bolus doses. If there is no bolus dose, enter 0. If a value is given to set the minimum bolus interval, use the numeric keys to enter the value and press Yes to accept and move to the next field. Number of boluses per hour. Use this field to enter the maximum boluses per hour. The range for this field is 0 to 15. When correct, press the Yes Enter key to accept and move to the next field. Press Yes Enter to accept. The soft medication limits will apply when the menu is accepted. The Med Limits field will then read On.